watch this later on. So we're going to be really want to thank you. Also, later this afternoon at 4 o'clock, we're going to be doing a second webinar. There's another link on our Facebook page or on the email that you received from us. We'll be doing a webinar this afternoon with LocalMed on how to use this. But I want to thank you all for joining, and I want to welcome my friend, Anna and I's friend, Mike. He's the director of services with Weave. We've known Mike for about 2 years now, and he's been gracious enough to jump in and not just talk about Weave. That's just the company that he has, and they're a great company and a service, but really how we can help others be able to go less touch to no touch from the front desk standpoint, and how that can make things safer for your patients, your team, and yourself. And so Mike's going to give us some ins and outs on that, and then how some of the innovations of forms and things of that nature that Mike has put together for us. So Mike, I want to say thank you for joining us. I hope you are unmuted.
All good. Thank you.
All right. And so what I'm going to do is I'm going to kick over to you, Mike, let you take over the meeting. But Mike is just a great guy. One of the things I like most is, as you all know, Anna and I do businesses with companies that are, first of all, ethical and provide a great service, but more importantly, and just as importantly, is the relationship we have. So one of the things that I like most is that Mike is kind of up the food chain with Weave. Is when a client has a problem, or a friend like any of you are to us, I can reach out to Mike and say, hey, can you put somebody on it? I know he's putting his best people out there. I've got Mike's cell phone, so I can bug him at 9 o'clock at night if I have to, or 9 in the morning our time, which is like 6 in the morning his time. But I know Mike, or one of Mike's key people, will be taking great care of you. And that's a real valuable asset in this time where questions pop up and things are unknown. So Mike, thank you for taking time out this afternoon in your busy day to share your knowledge with our clients, friends, and family throughout the country. And so, Mike, I'm going to turn it over to you and tell us what you can teach us and learn to make things safe in our dental offices.
Fantastic. Well, thank you so much for allowing the time. And as you said, we go back. I'll never forget the first dinner that we were able to sit down, really get to know each other. But what I've learned, and what I really appreciate though about working with Schwartz Consulting, is just the attention to detail that you give to your clients. I know that when you take on new clients, I know that you feel that weight and you want their success. And that's what I love working with Schwartz Consulting about, is the fact that it's attention to detail, it's true care, and you truly are dedicated to their success, and they become part of the family. And I love that. And so I love working with you guys. It's been fantastic, and I'm excited for this opportunity. As you mentioned, my name is Mike Buckner, and I've been in this dental tech space going on about 9.5, almost 10 years. And I love the dental industry. I truly do. I've worked with various dental companies over my tenure in the dental space, and based out of Utah. But what I love about the dental industry is the relationships. It is different than any other industry out there. You go to any dental meeting and it ends up becoming like a family reunion. I mean, just being able to reconnect with people. So I love the industry. I'm passionate about the relationship side, in dental, not just in the dental profession, but also between dental offices and their patients. Because we know that the success of the dental offices is directly correlated with the relationships that are had with patients. So, when Kelly and I were talking a little bit about what's going on, around COVID-19, and how to continue and how to change and adapt our patient process, once offices are opening back up. And as I mentioned, I'm in Utah, and so things are starting to open back up.
We have some offices in Ohio on here, Georgia, that are open, North Carolina open, but our Michigan clients, which are several here, are yet to open, and so we're getting those final stages ready for them.
Nice. Well, I think that there's good and bad in each situation, and the positive side of it is, as offices open back up, we're learning and we're seeing what's working, what's not working, what to expect. And so for those offices that are not yet opened up, I would just say learn from those that are opening back up. What's working, what needs to be shifted and adapted, and this is, and I know this is cliche. We say it all the time, but this is unprecedented. This is uncharted territory. And so we're all kind of doing the best that we can as we navigate this. But the one thing that we do all have in common is this bug, is this virus. And despite all the negative, side effects that this brings, and the health ramifications and the economic ramifications from coronavirus, what's been interesting and encouraging to see is how it's really brought people together. How it's brought people together to unite, to reconnect, to refocus on what is important. I know that for myself, over the last 10 years that I've been in this industry and working in business development, I've been on the road a lot, and I say that I know that Kelly, you live on the road, man.
Yeah, before this we were by March 1st, I think we were 60 days on the road in March 1st.
Gosh.
And now we've been 60 days at home. So we went from one extreme to the other.
Yeah, for me, this is the longest stretch that I've had off the road, in the last 10 years. And it's actually been refreshing. It's been really nice to be able to reconnect with what's important, and to try to look at, what good can come of situations like this. Now, you might hear some background noise because obviously I'm working at home. And my quarantine mates are these two little guys. I've got twin boys that are 2 years old, and when I say focus on the positive, this has allowed me an opportunity to not miss out on moments like this, things that I would otherwise have missed out if I was not working at home. And so again, I would just encourage you that it's easy for us to focus on what is not right and what's not working, but there's a lot of good that can come of this. And so take the time, make the most of it, because, we may never get an opportunity like this, again, to kind of refocus on things. And as Kelly mentioned too, I am with Weave, and I know that I want to just kind of say that this webinar, this presentation that I'm going to go through, this is not just a big, sales pitch or feature dump on Weave, because what I'm going to talk about are things that can be done with other softwares, or things that can be done kind of pieced together. But these are different techniques and different things that we are seeing and kind of predicting that are going to change in the patient experience as offices open back up, that I'm going to go through some of that. For those of you who don't know Weave is kind of that complete business toolbox. It started off as like a phone system for the dental practice. So when patients call in, it pops up that information up on the screen. So instead of asking, hey, I'm sorry, are you a patient of record? You go right into the details. Hey, happy birthday. I see that your daughter is not scheduled for an appointment. And, by the way, wish your husband a happy birthday for us. We'd love to see
caller ID on steroids, right?
Exactly. Caller ID on steroids. But what we've also done is we've been able to kind of pull different aspects of what is needed in a small to medium-sized business. So we're talking about, fax lines and reviews and appointment reminders, the phones, because otherwise we know that offices are going to be spending, chunks of money on each of these things that can add up. And if you're piecing together all the different parts that kind of make up the essential outreach and communication heartbeat of your business, you could look anywhere from $1,200 to $1,500. So we're trying to kind of combine those things into one little business toolbox to help you run and manage your practice. So again, going back to this bug, going back to coronavirus, the one thing that we do know with disruption that this has caused, disruption brings change, and change isn't always a bad thing. I want to give the example of 9/11, right? If we look at days kind of pre 9/11, I remember as a kid, I'd be able to, we'd go to the airport to pick up my dad from a business trip, and we could go right up to the gate with no security or anything. You could just walk right up to the gate, have them come off the plane, greet them there at the gate. But then once 9/11 hit, and after 9/11, there were some things that changed with that disruption. There were some things that changed, and now we can't imagine what it would be like to just walk through the airport without the additional, security screenings. And so there's new processes, there's new things that are going to happen when we see big shifts and big changes and big disruptions like this. Some of those things that, at Weave, we were able to kind of come together with our developers, come together with other dental professionals, and really kind of assess what is going to be changing in the patient experience. When people are coming back, what should they expect? What day-to-day things that are completely normal that we have been so accustomed to, what are those things that are going to be maybe completely different? And how do we adapt to that? So I'm going to go through and highlight what some of those things may be. For example, patient forms and wellness screenings. So now, I know the ADA kind of released a template for wellness screenings, basically kind of screening your patients to make sure that your team is safe for them to come in if they've been exposed to anything. So we're going to talk about how to conduct some of those wellness screenings in an efficient way. Patient forms. We're going to talk about how to, what's shifting there, what's going to be the norm, and how do we get that patient, intake process down. Now, patient forms, especially paperless forms, this is something that's not new to the industry. There's a lot of companies that do this. So we're going to kind of talk through some of that. Waiting rooms, something as simple as waiting rooms and having people come in. When we are told to maintain this social distancing, what's going to happen with waiting rooms, and how do we shift and change our strategy around patients just coming in, waiting for their appointments. Payments and transactions. Now, this is a big one. I went to a local business as things are opening back up here in Utah. I went to a local business, and basically it said, no cash is accepted, and touchless payments are preferred. So it's like, yeah, they'll take a credit card, but they prefer a way to transact business where you're not passing cash or cards back and forth. So we know that those things are going to be changing in that process. And then just overall maintaining patient care. How are we keeping these relationships going and that patient communication? How are we kind of shifting and adapting that? So let's start off, first of all, with patient forms and wellness screenings. Two different things. One is new patient intake forms, and the other one is screening those patients, doing kind of a pre-appointment screening to make sure that they haven't had a fever, that they are not symptomatic and coming in. Now, the process that a lot of us are familiar with, whether it's an iPad that we're handing out, whether it's a clipboard maybe, they come into the office, they sit in the waiting room, you pass out a clipboard with a pen or a pencil to have them fill out their information. You ask them to arrive 10 to 15 minutes early so they can get this taken care of. And I know that most of the times they're coming like 2 minutes before. But just that whole process of passing around a pen and a clipboard, this is something that we foresee going away. And we foresee the norm to be, how do we come in, how do we get this taken care of without requiring them to fill something out? Now, one of the main reasons for that is, a study that was done on the average pen in a doctor's office and the germs and the bacteria that are on a pen. An average pen in a doctor's office has 46,000 times the germs that the average toilet seat has. Now that blew me away. And you think about that. You think about that pen that's being passed around. Now I know that we're sanitizing like everything that's touched, but people are going to be leery of that. Handling pens. I know that when I go transact business or pay with a credit card, I don't want to touch the pen. Especially if they're holding gloves.
The ADA is recommending to just give the pens away because of that.
Exactly. That gets kind of expensive, right? But I know that when I go and you go to buy something at a store and they pass you the pen, here, do you want to sign this? And it's interesting because the cashiers, they may even be wearing gloves and will pass you a pen, here, can you sign this right there? And yeah, the gloves are protecting them, they're not doing anything for the patients, they're not doing anything for the clients who have to use the pen to sign. So again, that's something that's going to be going away. And then how do we conduct these wellness screenings? So first off, one solution that Weave offers is being able to send a wellness check, kind of a pre-screening survey to your patients. This is an automated text that can go out where basically it's saying, hello, Jonathan, due to the spread of COVID-19, we require you to fill out this form before coming into our office to ensure that we can honor your appointment. And then when they click on that, it asks them a series of questions. Now, we have updated these questions to basically directly reflect what the ADA's guidelines or ADA's suggested questions are for pre-screening those patients. And so when this text goes out and the patient clicks on it and they fill out this information, you can see real time, you can see what the patients, what the responses are. So if you're in the office and you send this text out and you're looking at your patients for that day, you can go in and see if anyone is symptomatic so that you know if you need to reschedule that appointment. Now, otherwise, if you don't have a system like this that can do that, I would suggest looking for ways that you can send this to the patient before they come in, because obviously, especially something like this, you have to. Because once they're in, if they're filling out, that they're symptomatic and they're in your office, it's too late. So you've got to find a way to be able to have the patients fill out these pre-screenings. And again, this can be done through a text, through an automated text that your team can see real time. Now, that's for the wellness screenings. Now, the second part of this is your patient intake forms. Now, again, paperless forms, it's something that's not new to the industry. There's a lot of companies out there that do this. Weave has kind of joined with those companies, and so we now have paperless forms, patient intake forms. Now, these forms will write back into the majority of practice management software. So you have EagleSoft, Dentrix, Open Dental. That patient information, they can fill out those forms out and send those in before they come in, and it's actually written back into the practice management software. Now, again, whether you use Weave, whether you use MConsent or another company out there that does these forms, I think that this is where things are going. This is kind of the direction of the expectations for the patients, and to help you save time in the office when patients are coming in, so that they're not having to fill this out beforehand. So that's going to be kind of a big thing to take note of. Now, once they filled out these forms and they're coming into your office, how are we going to address the issue of the waiting room? The waiting rooms, as we know it, what we're accustomed to is they come in and everyone kind of congregates in this waiting room, waiting to come back for their appointment. With social distancing guidelines, I know that for myself with my boys, whenever we take our boys into the doctor's office for like an appointment of any kind, you walk in and they've got like the sick side and they've got the healthy side. So if your kids are sick or symptomatic, you're supposed to go over to the sick side. And I hate that. I hate taking my kids over there and having them wait in a contaminated or sick side, because you don't know what other germs anyone else is carrying. I would much rather wait in my car until I'm ready to go back rather than wait in that waiting room. That point right there, waiting in your car, is kind of what sparked the idea of a mobile waiting room and having patients wait in the comfort and safety of their own car. Now, if you're using Weave, this is something that can automatically be sent out. If you're not, look into your patient communication systems to see if you can customize a message that is something like this, that basically is sent out the day that they're coming in for their appointment. Maybe this is something that's sent out 2 hours before their appointment automatically. That basically says, hello, Mike, to help maintain social distancing, we ask that you text us once you have arrived. Please wait in the comfort of your car until we are ready to see you. And then once that patient arrives and they text, okay, I just pulled up, I'll wait for your text. Depending on the system that you're using, you can see that notification pop up on the screen. Or in some cases, like with Weave, you can see that on your mobile device. You can get that notification on your mobile device or on your Apple Watch. So if you're back working in the operatory, and maybe you're limited on team, because this is kind of a big issue too. The PPE, that's expensive. That protective gear is expensive. And are you going to have all of your team members, wear the protective equipment? Or are you going to kind of limit, the interactions with those patients? So if you've got, an Apple Watch, you got an Android or a way to get a notification. I know with Weave, you can see that once that patient comes in, and then you can, yeah, go ahead.
Quick question. So with this texting and so forth, it's showing on your computer screen, not someone's personal phone, correct?
That is correct.
As
So for the patient, yeah, that's correct. So it can actually be done two ways, if for a lot of patient communication softwares that are out there, you'll probably see a notification pop up on the computer. With Weave, it's the same way. You'll see the notification pop up on the computer. It will actually stay up on the computer until somebody sees it. Or if it's synced with the Weave app on mobile devices, which is a HIPAA compliant app, you can even set it to get the notifications like on your iWatch. So if you're back in an operatory and you can see, oh, Jane's here for her appointment, I'm going to go up and message her that we're ready to bring her on back. So you can even have them. I've even had offices that have said, they don't have anyone, managing their front desk, or they're managing that remotely. And so basically when a patient shows up, someone from, a hygienist or an assistant can come to the door, greet them, and bring them on back so that they're not waiting around anyone, and the forms are already taken care of. They're ready to go back for their appointment.
When you say the forms are taken care of, Mike, they're going directly into the patient's notes. They're not having to be scanned, which is, again, a big reason I like Weave forms.
Exactly.
Okay.
Exactly. They can be filled out beforehand, and those intake forms are written back into the practice management software. Yeah. Now, so again, just waiting rooms. This idea of a curbside check-in or a mobile waiting room, whether you're using Weave or not, look at your systems. Look at your patient communication systems. Or worst case scenario, if you have to, text those patients before they come in and just say, wait in the comfort of your own car until we're ready to bring you back. That will kind of help with the whole maintaining that social distance. So the next part, they've had their appointment, they've come in, they're on their way out, or they're leaving, or maybe before their appointment. How do you transact? How do you collect payment for this? Now, this is something that is kind of a big topic right now, is currency, credit cards, the germs that are being passed around with that. Right now, I know that it's like, what can you do during quarantine? You've got two options, it seems like. You can go outside and go for a walk and get some exercise, or you can go get takeout and go curbside. So you can either eat, work out, those are kind of our options right now during quarantine. And if you're going to get takeout, I know that for myself, when I go through a drive-through, they pass the whole credit card terminal out the window and have you stick the card in. Or they ask, do you have Apple Pay? And you can just scan it right there so that you're not having to touch anything. So this is changing how we're transacting business. And I want to kind of give you a little example of the germ score, for example. Now there's something that's called a germ score, and the germ score is rated, and obviously the lower the score, the less, I guess, disgusting a surface is, for example, in a restaurant. Now in a restaurant tables, the surfaces to eat in a public restaurant must have a germ score of 10 or less to be required as a requirement to be considered clean enough to eat on. Now, putting this into context, the urinal at Penn Station has a germ score of 163. So big gap there, right? From 10 on a restaurant dining surface to 163 at a public restroom. Now, when we think of how we transact business, the dollar bills, the currency that we carry around in our wallet that has been passed from person to person to person, not to even mention the coins or the credit cards, I want to ask, what do you think would be more contaminated or have a higher germ score? Now, I know that for myself, it was a no-brainer. I'm like, well, it's got to be currency. It's got to be dollar bills, because I don't know who's handled those dollar bills before. Now, dollar bills, the currency, had a germ score of 165. That is huge. Now, if you remember what the Penn Station urinal was, 163, currency has a higher germ score than some public restrooms. Now, I thought that currency would have a higher germ score than credit cards. Credit cards had an average germ score of 285, and in some cases a lot higher than that. So
I read the reason on that is the crooks and crannies of a credit card versus the flat bills.
Exactly. The crooks and crannies, the plastic that's being used, how it can collect on some of that. So you think of passing that back and forth. When I read this study, I like grabbed some Clorox wipes. I'm disinfecting my credit cards and everything. And that really kind of changed my view on, passing credit cards back. Or if you're at a restaurant and you pay with a credit card and they take your credit card to the back, who knows who else has handled it or touched it. So where things are going is using a mode of payment like Apple Pay or Android Pay to be able to pay without having to necessarily touch or pass a credit card back and forth. Now, for an example, Starbucks, they knew where this was going. They had this down pat. And I say that because there are actually more users that use the Starbucks app than Apple Pay and Android Pay. Like there are more users that use the Starbucks app, and they do it in kind of I would say they kind of do it in a sneaky way because you want those points. You want those stars to get you a free coffee. So this changed everything though, because if you're driving to, in the morning on your morning routine and you stop at the Starbucks on your way to work, but if there's a huge line like in the drive-thru, you're not going to wait. But if you use the Starbucks app, you can order beforehand. So you can actually just walk right into Starbucks. You can kind of pass the poor, people that are waiting in line who don't know about that. And you walk right up, you grab your coffee, you walk out the door like you're royalty. And you're kind of chuckling at the people the sorry people who have to wait in line. So this is kind of changing how people transact. Now, when we think of mobile payments, we think of smaller ticket items. We think of, coffees, we think of gas stations using Apple Pay to scan. So why would we think of, transacting business, for example, in a dental office using something like that? Now, the simplicity of the mobile app, it's not necessarily, you think of like Starbucks, it's not necessarily that easy to place an order using Starbucks, but yet people do it and they learn it. I mean, to go through and order your drink on the Starbucks app, I don't know if any of you are with me, but when I'm trying to order for friends and I've got to go in and look at the, double mocha frappa latte chinos upside down, sugar foam on the side, soy chai, whatever, it can get complicated. But yet, this is how people prefer to shop at Starbucks. Now, the other analogy that I want to give is when Tesla came out with their truck. And if any of you remember, when Tesla came out with their truck and they had that like triangular shaped UFO looking truck, I wanted to check it out. I wanted to see, because I heard that they had these bulletproof windows that apparently weren't that bulletproof. They threw a ball at them and they broke. I looked it up. I looked it up online and pulled up the Tesla Cybertruck, and I noticed at the bottom where it said order now. And I thought, there's no way. There's no way that you could basically buy a car on an app that quick. So I looked around, made sure my wife wasn't looking, and I clicked on order now just to kind of explore that, see where it would go. It took me to the next page. It took me to the next page where it asks me, do I want a single motor, a dual motor, or a tri-motor? Okay, so basically it's kind of asking me, do you want the Grande, do you want the Venti, or do you want the Trenta? I mean, it was that simple. So as I scroll down to the bottom, boom, due today, $100 with Apple Pay. I could literally order a $70,000 car on my phone with 2 clicks. Now, this is how things were going before coronavirus, was reducing the barriers to transact business, even with large ticket items. So you think about your practice, you think about your dental practice, and when you have patients coming in, sending them a text that says something like, hi, this is Carly with Alpine Cosmetic Dentistry. I wanted to send you a link to view and to take care of your balance with us and to easily submit payment. Now, when you click on that link, you can actually see the invoice and you have the option. Now, this is a method through Weave, okay, where you click on that text to pay, you can see the invoice, And you can either pay with a credit card, with Apple Pay or Android Pay that's already stored in your phone. So, so there's some other methods out there that offer this mobile text to pay. And I would highly consider looking into this. Now, this is, if your patients are leaving, if they have an overdue balance, or you want to send them away to pay using their mobile phone. But there's also another thing that we need to be aware of, which is credit card processing machines that allow Apple Pay. When you have patients coming in, again, can I pay with Apple Pay? We're seeing a big spike in the demand. And places that I've gone, first thing I ask, instead of passing them my credit card or paying with a credit card, do you take Apple Pay? I want to just pay with my watch. And a lot of places are saying, we don't yet, but we're getting it especially because of coronavirus. So your credit card processing terminals, if they are not Apple Pay friendly, this is something just to keep in mind. If you do need a solution for that, Weave does have a payment processor that is tied in with Weave, that syncs with Weave as well. And so we can send that out to your office, and you can have a method to use Apple Pay or Android Pay for that.
So Mike, you're saying the Weave app or the Weave has the ability to accept Apple Pay?
Yes, absolutely. So two ways. One is text to pay, where they can actually see the invoice before they pay on their mobile phone. The next is if they're coming into the office and they want to pay with a credit card or use your payment processing device, they can actually just use Apple Pay to make their payment and walk out the door.
And again, because it's an app, though, it does work into the computer, not on an employee's personal phone.
That is correct. Now, okay. These again, this is a system. Two different things. One is the text to pay, where from the Weave app HIPAA compliant portal, you can actually send a link to the patient either beforehand or once they leave. If they've got a balance, you can send this where they can make that payment, or if they're in the office, they can use the credit card processing machine that has Apple Pay and make that payment. Now, if you don't want to switch out your whole credit card processing, merchant services, you can just use the text to pay, and it basically Weave goes through Stripe, and so for the most part, they will look at your past credit card statements and evaluate what rates they can get. For the most part, though, if you're switching your whole credit card processor out, they can either match or beat those rates. So just something to be aware of as you're looking for options to offer Apple Pay or a touchless method to make payments. Now, the last part, and again, I had a question on this too, a question of, is it safe? Is Apple Pay really safe? Or, a text to pay, is it safe? And actually, I would say it is considered safer than the actual credit card that you're passing back and forth. I know that I carry this around. This is my card wallet, and it's RFID so that nobody can scan this. Now, with text to pay or Apple Pay, these methods of payment, especially text to pay, it sends an encrypted method of payment so that you can't. It's not just sending your credit card number. It's encrypted form of payment information. So the last part that I'm just going to kind of end things on is continuing patient care and communication, especially during coronavirus. Now, whether your office is opening back up, whether you're still shut down, what this is really kind of highlighted is our need to communicate with people, with patients, with customers, with clients using text. This is not a new idea. Not just using text, but using the mobile phone. So what we have found, there's some great systems out there, and Kelly can kind of talk you through some of the other ones as well that offer the ability to see your schedule on your mobile device that's HIPAA compliant. Weave has a solution for this where through the HIPAA compliant Weave app, you can actually control who has access to it. You can pop up your schedule, and you have to log in. You can use the biometric scanning to log in. But you can pop up your schedule from home, and you can look at what your schedule looks like. You can click into any of these patients, and you can see who's coming in, the basic reason why they're coming in, if they've confirmed, and if you need to reach out to that patient. Let's say that you need to reschedule or they've got questions. You can click on call or text from your mobile device while you're at home, and it will actually send a text message, or you can place that phone call from your mobile phone, and it looks like it's coming from your office phone number.
That's a nice
key.
feature.
That is key. You don't want it coming from, I would say you don't even want text coming from like a short code, like a 5-digit code, because when I see text coming in from a short code, I don't look at them anymore, because normally they're just, it's spam. My wife has signed up for another coupon somewhere. I don't really look at those. And in fact, 52% of short codes go unopened. So if you want your patients to be getting your text, to make sure that they're opening them, make sure that you're sending those text messages, whether it's from the Weave app on the computer or from your Weave app on your mobile phone, that those texts and those phone calls are coming from your office phone number. And I would say, especially during these times where things are shut down, even you just checking up on your patients after hours and sending a text that says, hey, just wanted to check up and see how the swelling is going, or hey, thanks for choosing me to be your dentist. Those types of interactions they go miles, especially for building that patient loyalty. So, again, I would really consider having a solution that you can keep in touch with your patients while out of the office that is HIPAA compliant.
Mike, quick question. When they get email confirmation for their appointments, does it come from a Weave email or directly from the office, like Kelly@kellyschwartz.com?
Yeah, they'll see what email that's coming from, so you can set that email
to go either way.
Exactly. Yep. And so they'll see that email come in, and those confirmations will be seen as well. But the very last thing that I just wanted to kind of highlight is, we know that there's been an increase in a need or demand for teledentistry, for telemedicine, for a way to continue to communicate with patients, whether it's a consult, whether it's a checkup on them. And I know that there are dental codes as well. So you can do a consult with your patients using a teledentistry solution. Weave has a partnership with a teledentistry company to where we have a means for you to do these teledentistry consults and to continue that patient care, have them kind of fill out their patient information, their surveys, that communication through a portal, and kind of set up that virtual waiting room to do those consults. And so all of these things really come down to this. During this time, during this pandemic, while things are shut down, this is an opportunity for us to really double down on the care that we're providing and the attention to detail, the connection, the communication that we have with our patients. And during these times, it's a good opportunity to build that patient loyalty, because when all's said and done, I just want to end with this quote that people don't necessarily remember what you did or what you said. And I love this because it says that people will remember how you made them feel. And the simple text to check up on patients, whether it's even just checking up on them to say, hey, just wanted to see how you and your family are doing during the pandemic, during the shutdown, during quarantine. How are you guys doing? How are you holding up? Those personal connections, this time, this quarantine has really allowed people to kind of refocus on relationships. People need that interaction. They need that social connection despite the distancing that's taking place. So again, if you have questions about Weave, about the phone system, we do have different ways that we can help you out during this time. If you're interested in Weave, currently right now we are, especially through Schwartz Consulting, anyone who is interested, we want to make sure that you don't have that hardware cost. So free phones for clients that are signing up with Weave, and then there's a lot that we can do as well with our onboarding fees. We just want to be able to help you, give you some solutions on how to prepare your offices to reopen. So if any of you are interested, and I'm going to leave this up here for a second, if any of you are interested, if you're a current Weave user and maybe you've got some questions about things, feel free to shoot me an email, mike.buckner@getweave.com. Shoot me an email. I'd love to see how I can help you out. If you are not a Weave customer and you want some more information on, maybe it's the forms, maybe it's the mobile app on getting new phones out for your office even, go ahead and text the keyword phones to the number 797979. If you text the keyword phones to 797979, there'll be a link that will be sent out. Fill out that link, that information, and then especially during the quarantine, to help support local businesses, we're actually giving a $50 gift card. If you want to do a demo with Weave, you want to explore Weave and get some questions answered, fill out that form. We'll send you a $50 DoorDash gift card for you to go out and get some takeout for your family. So
and let Mike know that you work with us as well, and that you're working with, for example, if you have DI, let them know so they can customize the program that fits you best. So Mike, I just want to summarize the 3 big things that you're able to help us with. The first one is no touch forms. The second is the payment online, and the ability to customize the reminders to let them know the intake process. Yes. And those are 3 really big things to help reduce the stress of your front desk team and as a safer barrier.
Okay. Absolutely. And then also, if you do have team members, let's say that your office needs to work, you've got your front office manager that you want to work remotely for a while, or you want them to work out of a back room in the office, not to be up and exposed to people. Depending on, you can even have them work remotely from home and still have the ability to get incoming calls through that are all recorded. You can record all your calls and text. Everyone can kind of be connected. They can be at home and still get those calls in to the office.
All right. Any questions? Feel free to unmute yourself, and we'll try to handle that, or type them in the chat, and we can do that. This broadcast is going to be, I'll throw it up on our YouTube channel. So if you are a Schwartz Consulting Group friend, fan, or client, please follow us on Facebook as well as on YouTube. So any seminars or webinars we do, you will have access to and be immediately notified. Later this afternoon at 4 o'clock in your email, you would have got an invite to our Local Med webinar as well for online scheduling ins and outs. So Mike, I cannot thank you enough for how much you've given insight and helped some people. I'm getting great private text in the chat, how much they appreciate it in the insight you're giving. So just want to say thank you to everybody who joined us online. And as always, feel free to reach out to Anna or myself for questions you have. We'll put you in touch with Mike, but his numbers are up there. And so, Mike, thank you for the great offer for our friends and clients. And if there's anything else we can do for any of you, let us know. Mike, go ahead.
I just wanted to answer some questions here. Let's see. So one of them is the wellness forms, the questions around the wellness forms. Earlier on this week, we received all of the ADA's guidelines for the wellness forms. And so that update to all of the wellness form questions that are basically required, the required questions that ADA is stating, all of those, you'll see that in the Weave platform probably by the end of the week or early next week. All of those are being updated. We have some basic questions that we started off with when this was a necessity to have these wellness screenings. And then once ADA kind of said, hey, here are the questions that we need to ask, we're updating those too. So just to answer that question.
Can the doctors customize additional questions if they want to know?
So we're right now, I think what we're going to have is one of the questions on there is going to be optional, which is, have you been, the very last question the ADA has is, have you been in an affected area? And I think we're going to have that as an optional question because right now, everywhere is infected. Everywhere is an affected area.
The question that we're going is, do you work in healthcare, a senior center, or traveled by plane or had, people coming? So I think the ability to customize it. A question that came in is that someone, Dr. B, has already sent in that form as we spoke. It says, is there something that they tell the person that they work with us? Because that's not an option.
You know what? I've actually coded that page. So that landing page right now, anyone who fills that out, I get a notification and I know that they've been on this webinar. So
they
actually
know you work
won't
with
be
us.
a spot in there. It's actually already coded, and I know that they've been on this webinar, and I'll be able to make sure that we take care of them.
So they know they're working with us in that way.
Exactly.
Perfect. All right. Any closing comments, Mike, or anything we need to know? Any insight?
No, I don't think so. I really appreciate the time. I wish you all the best of luck. And if there's anything that I can do to help you out in any way, please send me an email. I'm happy to get you in touch with the right people. If you've got questions, if you're current users, or if you just have questions about the Weave system, period. Would love to make sure that we help you out.
And if you do reach out to Mike, one thing I know, Mike isn't going to jam Weave down your throat. He's going to answer questions that you may have about other software, pros and cons, where they're different. He's going to treat you like a friend and family as we do. And it's one of the reasons we have Mike on here. There are other companies that are great, but again, relationship is important, and Mike's one of the best. So
I am not, and it's important to know, I'm not a sales rep. I'm not commissioned on this at all.
You're a resource.
I'm happy to help you determine if it's a good fit for your office. And if you have questions about other systems as well, I just want to make sure that you're taken care of. So
as do we. So Mike, thank you again. Everybody that's on, we hope to see you at 4:00 for our local med training and demo ins and outs. And we really appreciate you. So thank you and have a great day. Hoping. Trying to stop recording. Trying to